Back. Strokes are something doctors constantly fight. They're always trying to teach ways to prevent them.
And Denise Goings is the stroke coordinator at Medical Center Navicent Health, and she's here to talk all about it. So good morning to you, Denise.
Good morning. Thank you for having me today.
Yeah,
so early in the morning.
I know, it's so early.
Early.
My goodness.
Dark
Never
early.
too early to talk about strokes.
No, never too early. Never too early.
So tell us, what are the first things people need to know about stroke awareness?
Well, one of the things that we want to get across to the public is that there's almost 800,000 strokes a year in the United States. So about every 40 seconds someone is having a stroke.
Wow.
And unfortunately someone dies of a stroke about every 4 minutes. So getting out awareness, programs like this, we thank you so much for allowing us to get out and talk to the public, making them aware of signs and symptoms of stroke, risk factors. That's one of the reasons that we're putting on our program at the Monroe Medical Regional Complex up in Forsyth on Wednesday. It's from 1 to 2. And we will be talking about explaining Stroke 101, just general information.
Information people
basic
need to
information, yeah, just basic information. How to recognize those signs and symptoms. Unfortunately, only about 38% of Americans can name all the signs and symptoms of stroke, and that's pretty startling in today's time with all the media and television coverage and internet and Google. You would think that more people,
you think the information would get out there. So what are some of those signs and symptoms to make sure we're part of that 38%?
I want you to be a part of that. I want you to be a part. Well, we talk about sudden weakness in the face, the arm, the leg, particularly on one side of the body, sudden trouble speaking. Patients can have slurred speech, inappropriate speech, not saying all the words. They can have sudden trouble with their vision, double vision, blurred vision, loss of vision, and a sudden severe headache, sudden trouble with their balance. They're just not walking right, you know, they're just not talking right, they just don't look right.
These sound like some of the things that you wouldn't typically be able to control, but is there or are there prevention methods that we can take so that we're not in that percentage of having a stroke?
Good question, good question. There are. And knowing those risk factors, things like high blood pressure, high cholesterol, knowing what your numbers are, being aware that there are two types of cholesterol. I always tell people the LDL and the HDL. The L is for lousy. Remember, L is for lousy and L is for low, and then the HDL, the H is for healthy and the H is for high. So just knowing what your numbers are, knowing what your blood pressure is, sounds simple. But unfortunately, not everyone knows those.
That just means you have to go to the doctor regularly, right?
Right, I was going to say, I mean, it really comes down to just talking with your doctor, talking with people such as yourself, you know, that know these things and go to some of these classes as you guys are hosting up in Monroe County.
Right, exactly. Just being aware, just knowing those signs and symptoms, being able to recognize them by using the FAST. We don't have to be a clinician, you don't have to be in the medical field. It's called FAST, face, arm, speech, and time. And fortunately, the American Heart Association, American Stroke Association has done a great job. You'll see billboards across the state. You see advertisements on television, a lot of PSAs out there now.
Absolutely.
Thank you so much, Dr. Denise.
Well, thank you so much. We appreciate it.
All this information on our website. She's going to talk about FAST and as well as signs, symptoms, ways you can prevent things.
Prevention methods, everything.
on 41NBC.com.
We're back in 2 minutes. Stay with us.